It's a pleasure to introduce Aman Bandari, who is with the White House Office of Science and Technology Policy. And he works on healthcare strategy and policy at the intersection of technology and innovation. And what's interesting also is that he spent about 2.5 years with Medicare and Medicaid. And so, he talks, he's another data geek who spent a lot of time with health data and is very, 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 very passionate about health data, of which he made a point of coming up to me at a function at the White House to pull me aside and tell me all about it and who I needed to meet, which was Todd Park, and this all happened in about 2 weeks' time. So we have Todd, which is great. This is how stuff moves and rolls in Washington, D.C. But without further ado, I want to bring up Aman to introduce Todd and get things started, because I know it's going to be a really, really interesting conversation. So, Aman.
Thank you. Karen, thanks for the introduction. It's great to be here today. I could talk about data all day long in my weekends. I tell you, when I was, I think I was an undergrad, even a grad school, I never thought that I'd be so passionate about data. But it's a great pleasure to be here to introduce somebody who is 10 times more passionate about data than just about anybody I've met. And that's Todd Park, who's the Chief Technology Officer at Health and Human Services. And the CTO name is a little bit of a misnomer because he's really an entrepreneur in residence. And he's one of the people that I have the deepest respect for, and probably one of the best people that I've ever worked with in government. And so, Todd is leading some tremendous efforts at HHS, and you from his bio, you have his background. He graduated from Harvard. He led the founding of one of the most successful health IT companies. He's also worked overseas in India, where he helped found a venture called Health Points with Ashoka. And so I think what makes Todd unique is not just the credentials that you see on paper, but what you get in person. And his incredible enthusiasm and ability to motivate is unparalleled. And I think we did this community health data initiative that we've got under open government with Secretary Sebelius, and one of the journalists wrote an article saying, making data sing. And I think when we think about data in this community and other communities, we've got to think about how can we make data sing? How can we make it sexy? And I think the person who makes it sexy is actually Todd Park. So it's a huge honor to introduce him, because his ability to motivate and get people to see data in a creative and unique way is something that we need. And I think it's especially important as we do outreach to communities. And one of the things about Todd is that he not only reaches into the data in a very detailed way, whether it's running something like healthdata.gov and the Community Health Data Initiative, and understanding payment mechanisms and things like that, but also in terms of outreach to the community. And so he was also the leader of the healthcare.gov portal, which is probably the most public-facing aspect of the health reform bill. And I think thinking about the connection between the data itself and the technical aspects, but also the outreach to community and what that means in terms of design, and what that means in terms of communication. And so I'll stop there, because you should be listening to Todd and not to me. Thank you very much.
Geez, I cannot possibly live up to that. Thank you, Brother Bandari. Who's been a phenomenal partner in all this work. Welcome, welcome, welcome. Thank you for welcoming me here today. And big data sexy? I'm going to try to do that in the next half an hour. I am absolutely ecstatic to be here today to speak with you about the idea of unleashing the power of what we call open data to improve health. And would love to recruit you to join this growing community that's actually working to do this. How many of you actually are familiar with the Open Government Initiative? Okay, so for those of you who don't know, it was like the fourth thing the president did after getting inaugurated. He signed a directive that said the government should become more open, meaning it should become more transparent, participatory, and collaborative. Transparency is all about publishing government data to help citizens hold the government accountable and create social benefit. And participatory and collaborative is all about the government working with the academic sector, private sector, nonprofit sector, collaboratively to take on the great challenges of our day. So what every agency's done in response to the president's directive is publish an open government plan. Ours is at hhs.gov/open. And one of our flagship initiatives in our open government plan is something we're calling the Community Health Data Initiative. And the whole idea behind CHDI is to turn HHS into the NOAA of health data. So for those of you actually who don't know this, I didn't actually know this until I joined the government a year ago. There's an agency called the National Oceanic and Atmospheric Administration that supplies virtually all weather data in the United States. So it's not like your local newscaster measures barometric pressure himself every morning, right? It's actually the case that NOAA does that for him and for everybody else. It collects data, huge amounts of data about the weather and then published it online in machine-readable format, downloadable, so that anyone can pick it up and use it free of charge without intellectual property constraint. And then a whole bunch of innovators outside NOAA turned it into the Weather Channel, weather.com, lightning newscast, iPhone weather apps, weather research, the sheet in your hotel that says it's going to rain tomorrow, so you prepare to do stuff indoors. All that stuff is done by people who aren't NOAA. A whole panoply of innovators who take NOAA's data and turn it into applications, insights, products, and services that benefit the American public in a massive way and make weather data pervasive, coming at you from every direction, helping you lead a better life. So the idea behind the Community Health Data Initiative is to actually do the same thing with health data, right? To create the same kind of revolution of innovation and use of data that happened when NOAA released weather data, or the military released GPS data, or the SEC released range data. Do the same thing with health data, leveraging the just unbelievable amounts of data that HHS has spent tens of billions of dollars over the years compiling. So that's the basic idea. So what we did was on March 11th, we convened a small group of innovators, 45 of them, at the Institute of Medicine and said, is this the dumbest idea of all time? Or is this actually a pretty good idea? And the group that we convened actually had two prominences. One group of folks, people like Don Berwick or Ed Sonic, who are just deep health rock stars, right? We've forgotten more about healthcare in the last 10 minutes than I'll learn for the rest of my life, right? The other group of people, the other group of rock stars, people like Tim O'Reilly. You know who Tim O'Reilly is? Tim O'Reilly actually is not the George Washington of the web, but maybe the Thomas Jefferson of the web, right? So he helped popularize the World Wide Web. He helped coin the term open source, Web 2.0, and is a rock star in Silicon Valley, in Memphis this week. So one of the interesting things actually to note is that Don Berwick and Tim O'Reilly had not only never met, they didn't even know who each other were, which really speaks to the kind of fragmentation and specialization of knowledge in today's society. But when they met each other, they fell in love. And had a fabulous conversation. And actually jointly said, this is a great idea. HHS is the NOAA Health Data is a fantastic idea. And then over the course of 6 hours, basically proceeded to brainstorm 20 different classes of applications that you could build to be helpful using HHS data. So at the end of it, we said, okay, well, this is the kind of ecosystem we're actually talking about. We'll supply a bunch of data. A bunch of innovators outside HHS will turn it into super cool applications that consumers, employers, providers, communities, public health officials, civic leaders, advocates can use to make better decisions and improve health. And what we're going to do, which is not necessarily typical of a gathering of experts always, is we're going to actually try to focus very much on the follow-up and turn this into action. So we actually challenge all of you to recruit your friends and build at least one of these super cool apps that you've brainstormed in the next 90 days. And we'll actually check with the secretary, but we're pretty sure she'll be cool with this. She will host a big meeting at the IOM with Harvey Feinberg, the president of the IOM, Deputy Secretary Bill Core, and others, to showcase your applications if you build them. We weren't exactly sure what was going to happen, but what actually ended up happening was, boom, a big explosion of innovation. We actually published a whole bunch of HHS data in a way that was easy to find and use on the CHDI website. And then these innovators recruited their friends and other people to build a bunch of apps that then went live all on June 2nd at this giant public meeting at the Institute of Medicine. It made the cover of Modern Healthcare, as you can see here. If you actually go to YouTube, and you've got a spare couple hours, search for Community Health Data Initiative, and you'll actually be able to see the 2-hour plenary session with keynotes by the secretary and by others, where 7 of the coolest apps that got built were demoed. One interesting stat, actually, is that this YouTube video now has over 13,000 views, which basically makes it equivalent to the Jonas Brothers Argentina tour video. And it's a 2-hour-long video about HHS data, right? But it's really pretty awesome. I mean, I start watching it, you just can't take your eyes off it. It's really good. And I'll just give you a little preview of it. I just want to show you just some of the apps that got built, because they really make the data come alive, make it sexy, to use a Bandariism, in a way that is really compelling. So a coalition of 3 entities, the Healthy Communities Institute, the National Association of Counties, and a company called Trilogy built something called Network of Care for Healthy Communities. It's a turbocharged community health dashboard that any county can set up as a website that first of all shows key indicators that you care about in your community, and in layperson's terms explains them to you and tells you what the trend line is and how you're doing against benchmark. Even more coolly, it links you into an inventory of promising practices that are interventions that other communities have executed, like Steps to a Healthier Salinas, that have actually made progress against that indicator that you actually care about. links you to an inventory of pending federal and state legislation that may impact the indicators so you can advocate for your particular position with respect to that legislation. Connects you to a set of resources in your county that can help you as an individual or a family with fitness, healthy weight, quitting smoking or diabetes. It's a really cool community health information and action dashboard that any county can set up really inexpensively and take advantage of networking with other communities and a whole base of knowledge that this venture put together, which is very, very cool. Went live in Sonoma County on June 2nd. It's now spread to 15 other counties plus the entire state of Arizona and is spreading across the country. Second, this is a very interesting example. One of Tim O'Reilly's laws is that if you want data to change people's lives, right, don't make them find it. Make the data find people where they already are, where they're already making decisions that the data can actually help. So this was an example where Microsoft Bing, the search engine, took our hospital compare data set, you know, this is not it's our hospital by hospital quality ratings, right? And downloaded that data set and integrated it into search. So as opposed to actually Americans having to know that there's a hospital compare website at HHS that they have to find and use, instead, whenever you type it in, say, New York Presbyterian Hospital in Bing now, it will pull up in the primary search result the patient satisfaction rating with that hospital versus today. They basically 50x'd the social return on our hospital compare data by 50xing the use of it by delivering it to people who didn't even know the data existed. Right? This is a really, really powerful lesson. Make the data viral, make it infect all the places on the web where people are already looking, and it'll actually help change people's decisions and their lives. Google actually built, this is another example, they integrated hospital compare data with Google Maps and Fusion Tables and built this useful little utility called a Google Hospital Finder. They made a presentation said that was called Best Places to Have Chest Pain in America. You can see how well they treated heart attacks and how friendly they were with people, but that was actually really, really cool. An application called iTriage, which is a really neat handheld app that helps you research medical treatments and diseases, procedures, and find providers. Downloaded a new data set we made available, which was a list of all the FQHC community health centers in America, and made it part of iTriage. So you can actually now, as of June 2nd, find community health centers on iTriage. And what they've said is tens of thousands of people have searched for community health centers on iTriage already, which increases access to care. Is always a good thing. This is an interesting example. It went live June 2nd at communityclash.com. It's a game, basically healthcare blackjack. And what happens is you pick your home city, Boston. You pick an opposing city like, say, New York, right? You dealt 5 cards face down, each of which corresponds to a health indicator, like smoking, diabetes, unemployment, obesity. You're allowed to swap out up to 2 cards for other community indicators where you think you beat New York, and then you show all your cards, right? So it sounds silly, but of the 20-something apps that got shown this day, all of which you could browse afterwards of the big floor show, the longest line by far, wrapping around the hole, was to play this game. I played it actually for hours with my wife that night. And I've been in healthcare for, better part of 20 years. I learned things about community health that I didn't know. For example, the rates of mental illness in America are much higher than I thought. I kept trying to find a city where the rates weren't incredibly high, and I couldn't. And that was a very important thing for me to learn, and it'll impact what I do as a healthcare leader and as a citizen going forward. Do y'all know what Farmville is? Okay. Anyone want to guess, in the first 18 months of Farmville's life, how many users it actually acquired? How many people actually, at the end of the first 18 months, were playing Farmville monthly? Take a guess. 73 million. Farmville went from 0 to 73 million monthly users in 18 months. And they're learning about, farming, right? Like sheep and bales of hay. But what if actually someone built a health thing? What if someone actually built a game that got tens of millions of users that happened to teach you about health and health in your community, right? The health of your family, right? I submit to you that that person will go down in history as a seminal figure in American public health, because they will actually single-handedly have educated more Americans about health than any number of public health lectures possibly could, right? So games are a really interesting new arena to basically make learning about health and improving your health entertaining. There's a lot of really incredible work being done here, and this is actually just one example. Finally, just one final example I just wanted to tee up, asthmapolis. So this is actually one dude, David Van Sickle, in Madison, Wisconsin, and he had this brilliant idea. He attached a GPS device to an asthma inhaler and linked it to a web app. So every time you use the inhaler, it records the time and place of your attack. So you can actually see a map, a place and time of where your asthma's happening. And there's a study about to come out that shows that in the target population, this increased asthma control levels by 50%. Because you can suddenly start seeing that all your attacks are happening at work. Or Tuesday morning when you walk past the cement plant, right? You can also anonymize the data and contribute to a map so the public health officials can actually see that, when weather is X, right, that on certain days, the cement plant in a 5-mile radius leads to a lot of asthma attacks. And so it's a really interesting example of crowdsourcing data to provide to the community in a way that helps improve health. And the punchline in all this stuff is that the government didn't do any of it, right? What the government did was actually make data available and provide a convening, right, which actually was responded to by innovators building incredible applications, leveraging platforms and knowledge that they had to do stuff that was just incredible in less than 90 days. And just a small taste of what is to come. So we're very, very excited about this whole idea of HHS as the know of health data. And we're now taking it to the next level. We launched on June 2nd something called the Health 2.0 Developer Challenge. You can actually check it out at health2challenge.org. But basically a website run by an organization, Health 2.0, where any government agency, foundation, or company can issue a public challenge. Someone build the best app that does X, I'll give them a prize. 13 challenges have been issued to date. An example actually is we issued a challenge around our hospital and dialysis center care data, saying who can build the best app that makes this data come alive on a mobile app or a website to actually help people make the right decisions with respect to where to get care. We launched Healthy People, as I think everybody knows, right? Healthy People 2020. A couple weeks ago, we issued a My Healthy People Challenge, public competition for developers to build the best application that allows people to customize My Healthy People, to have it their way, right? To pick the indicators they actually care about, be able to match it up with other information, link to best practices, link to other people who actually care about the indicator, and create basically your own personalized Healthy People dashboard. What's happening is that hundreds of developers are signing up to compete in these challenges. I think close to 400, 500 at this point. And 95 different teams, actually from around the world, as far away as India and Germany, building these applications, competing for prizes and recognition and the chance to contribute to meaningful causes. So that's actually been a really interesting phenomenon, and something I understand that folks here may be interested in formulating as well, in terms of a challenge to issue to the developer community on issues in the Asian American Pacific Islander community. Just to illustrate kind of cycle time, these are typically done for a period of no more than 3 to 5 months. So the first 6 challenges were closed out with winners celebrated October 7th, just a few months after June 2nd. And these are some of the sponsors who actually awarded prizes to the challengers. In addition, there's this growing phenomenon called the Codathon, Health Data Codathon, which Amon's been an instigator of in the field. But what's happening is that different entities around the country are convening hackathons or codathons, where people actually are invited to come together, scrub into health data, and build cool apps with the health data. This is actually a picture from the first such hackathon, which was held in Silicon Valley by a little company called HealthTap in October, actually late September, early October. And what happened is that they said, we've got a whole bunch of government health data, a whole bunch of other data related to health. We invite anyone from Silicon Valley to come in, check it out, and build apps together for a weekend. They invited, I think, friends who invited other friends, et cetera. They expected about 30, 40 people to show up, and 200 developers showed up. Those 10 labs are coding all weekend, building health apps. And what's actually interesting, kind of an unfortunate secret of the past with respect to Silicon Valley and health, is that healthcare has never been regarded as cool by Silicon Valley, unfortunately, right? It's been actually regarded as the place where the third-rate engineers go to die. The really cool developers actually go to Twitter and Facebook and so on. What's happening actually in the Valley right now, it's still a little early, but that's kind of my hood, right? Is what I'm hearing is that thanks to things like the hackathon and Amon being so cool, right? Health is now becoming sexy in Silicon Valley. It's actually something that's being regarded as a place where cool developers should actually be. And that's a big deal, right? Because the only reason my companies were successful in my prior life isn't because I was a particularly brilliant leader, right? It was actually because I just happened to recruit the best people, right? What I learned is that if you recruit the best people, you win. And if you don't, it doesn't matter what your business plan is, doesn't matter how good your financing is, you're probably not going to win, right? And so I'd submit to you that if you really want to build applications that change the world using health data, that the #1 thing you have to do is get the best developers, the best innovators, the best minds in the world to care and pay attention and link up with the healthcare rock stars to have like everywhere the Don Berwick, Tim O'Reilly marriage happening, right? And at that intersection is where magic with data happens. So get the best people in Silicon Valley, metaphysically speaking, the Silicon Valleys of the world, to care about health and health data, and you will change the world. And that's exactly what we're trying to do. So also actually, on October 7th, in addition to celebrating lots of winners of health challenges at Health 2.0, we launched something called Blue Button. Have you heard of Blue Button? This is actually another really big deal. We're actually now extending the whole notion of data liberación to personal health data, not just community and provider data. So it turns out that two of the largest repositories of health data in the world are the Veterans Administration and Medicare, right? And what we did was we basically, through Blue Button, enabled Medicare beneficiaries and vets to download a copy electronically of their own data in human readable form. We did not think this was actually a terribly big deal, but it turns out lots of other people think it's a big deal because the private sector doesn't generally allow people to do this. I don't know why. Maybe it's because hospital systems don't want to make it easy for you to jump ship. Maybe it's because it's hard for them to do. But we find ourselves in the curious position of being a cutting-edge innovator in establishing the principle that it's not the government's data, it's the patient's data, it's the vendor's data, and they should be able to get a copy of it. And so we've done very little promotion of this. We just had a niche Chopra and I announced it at a pretty geeky conference, Health 2.0 in Silicon Valley. We didn't really make a lot of it, really, in terms of a big deal publicly in the media. But to date, over 130,000 people have downloaded a copy of their own data, which is actually pretty amazing. And there are more and more companies that are actually taking that data and building the ability to upload it to a personal health record or application to help you manage your healthcare finances and make it really useful to you. So we're very, very enthused about where this is going. And what we're doing is we're basically just opening up the throttle on putting data out there for free, machine readable, downloadable, without intellectual property constraint. Data of lots and lots and lots of different kinds. So these are just a few highlights to actually punch up. One is that in January of 2011, we are launching a new HHS Health Indicators Warehouse. This might be of particular interest to this group of folks. It's the first ever HHS-wide Uber warehouse of community health data. National, state, hospital referral region, county level data on over 2,000 indicators of public health, of healthcare performance, tons of Medicare indicators that are brand new around utilization of services, prevalence of disease in the Medicare population, quality, preventable hospital admissions, determinants of health, like access to healthy food, all made available in a single warehouse, which will be a single website that you can go to, read about the data, get the metadata, download the data. We're also making it available via an API, an application programming interface, which is fancy. Well, of course, you all know it. So, but a lot of things actually don't know what an API is, but you do. And basically, an API from a technological standpoint is, as you know, a gate where you can actually auto-retrieve data in a really elegant way, and that's how developers really want to get it. And so we'll make it available via an API as well. We've also put APIs on our provider compare data, like hospital compare. There's a super cool National Library of Medicine API portal, which we launched in September. This actually now opens up a ton of scientific and medical data, like PubChem, RxNorm, Medline Plus, clinicaltrials.gov, through APIs. Healthcare.gov is this portal, as Anna mentioned, that we put up, that has a ton of basically insurance plan data and insurance plan pricing data. So we're making that available actually soon via an API. And the point being is, look, you name it, we're trying to put it online and make it available to download machine-readable data, whether it be community health data, provider health data, medical data, scientific data, personal health data, insurance data. If we've got it, since the American people pay for it, and if we don't violate privacy and put it online, we want to put it online and actually have it feed the ecosystem. So we are actually doing that on an ongoing basis. There are additional data commitments in our HHS Open Gov plan, which you can find at hhs.gov/open. But this is actually pretty wonkalicious detail, but it's important to mention. We also actually are changing the processes at HHS to actually open up data on a regular basis. And so one of the things Bill Core, my boss, told me, he's the Deputy Secretary of HHS, he said, look, Todd, you really want this to actually keep going, to actually act at the process level of HHS. He said, HHS, people come and people go, the process lives forever. So what we've actually done is we've rewired internal processes at HHS to make data sharing the default. So first of all, every time there's a new investment in data or IT at HHS, it's actually going to be assumed that you will be publishing any data produced for the public. You have to proactively explain why you're not going to in order to actually get your IT investment or data investment approved. Secondly, the HHS Data Council, which you're probably familiar with, is going to be engaged in a twice-a-year process where every agency presents all the data it has what subset of the data has actually been made public, and then identifies which new data it's going to make public to advance health, advance the Secretary's priorities and the agency's priorities. And so that will start in 1Q 2011, and will just keep feeding the ongoing supply of open HHS health data on an ongoing basis. And it'll all be contained in a super cool new resource called healthdata.gov. It's hard to keep track of this stuff. Healthdata.gov is a new one-stop resource. They'll be debuting in January 2011, which will have a comprehensive inventory of all federal data that relates to health, not just HHS, but USDA and PUD, et cetera, that's downloadable and available for free. It'll have a virtual apps expo, kind of like a virtual online version of the June 2nd meeting, which will have super cool applications people built using the data that you can actually check out. It'll have an online forum where people can talk about the data, complain about the data, request new data, talk about how they're using the data. It'd be phenomenal, actually, for this community to get on that online forum and talk about the issues that are particularly relevant to our community. It'll have a list of additional data sites that are not federal data sites, but have super cool free data that the ecosystem can actually check out. So it'll be like a one-stop shop for all of that, for data applications community, debuting January 21. In addition, one of the things that we've learned is actually just publishing data isn't enough. I mean, we used to think that, well, we'll put the data out there, everyone will celebrate, and do cool things with it, and we'll go home, right? What I actually learned was that you actually have to market the data. So one interesting stat or factoid was that when we actually had that March 11th meeting and people got really excited and said, we'll go build these apps, and then we put data out a week later on the website you could download, most of the data we put on that website was data that had been in the public domain for years. It was just really hard to find, really hard to work with, people didn't know it exists. Like to a person, not a single person from Silicon Valley, not a single one, right? These are like the coolest data ninja princes in the world, right? Not a single one of them knew that HHS had any of that data, which is pretty amazing, right? And so you can't just publish the data, you gotta market it actively. And so we're doing a lot to do that. So for example, that June 2nd meeting that has been viewed 13,000 times, we're gonna actually do that every year with the IOM, big annual open health data meeting. People who supply data, people who care about data, people who are turning into applications, people who are using those applications, get together, celebrate, talk about what they're doing actually going forward, and think of new things to do. We're going to keep doing these developer challenges, again, make health data cooler and cooler and cooler for Silicon Valley folks. This is an interesting new idea, which we're pursuing. In early February, we're going to do a HHS Health Data Journalism Workshop, which you might want to get involved in. And so what's happening is that working with the Investigative Reporters and Editors Association and the new Center for Computer Aided Journalism at the University of Missouri, we're convening a workshop for journalists to scrub into the health data, get familiar with it, tools that have been built that could actually help them parse it, and inspire them to write stories, build interactive utilities and maps to help get the word out about what's going on in terms of health, help raise awareness, help pressure decision makers to do something, and create value. So that'll be interesting. Hopefully that'll go well. If that goes well, we'll do that on a recurring basis as well. And then we're just doing all kinds of other things, sort of one-on-ones and one-on-10s and two-on-20s, in terms of meetings with people to get them excited about the data, get them interested in doing something. And the goal at the end of the day is actually for this not to be choreographed centrally or driven by HHS. The goal is actually for this ecosystem to be a self-propelled thing, where HHS is a happy sugar daddy and a happy cheerleader and a happy kind of celebrant, but just one member of a decentralized grassroots ecosystem of data supply, use, and health improvement. And actually, the self-propulsion is already beginning to happen. I mean, there's a bunch of stuff happening which I found out about after the fact. Like, I actually didn't know that the Sonoma County dashboard has been spreading across the country. I didn't know, actually, until Aman sent me an email that iTriage says that tens of thousands of people actually search for community health centers on iTriage, and they're actually pushing that aggressively. There are new startups, actually, that have been started based on government health data, HealthPath and Doximity. Companies like Microsoft are building new features of super cool apps that they have that are powered by our data. Agencies like HRSA are building their own mobile apps to help you find health centers, et cetera. Actually, another interesting trend is decreasing self-propelled ecosystem is private sector organizations are beginning to open up their data as well. So Gallup Healthways does this well-being index. So inspired by the Community Health Data Initiative, they've actually now agreed and put online to provide the well-being index data for the top 200 American cities and congressional districts and states available for download for free without profit constraint. And there are more private sector sources of data coming online on the same terms soon. And so the whole idea at the end of the day is, again, to replicate for health what's happened with the weather. And to have a whole virtuous spiral going where more and more data comes online, gets turned into more and more applications by more and more people that benefit the American public. and to do so in such a way that really leverages the compounded ingenuity of the American people. One interesting other bits of wisdom that I actually got told once by someone was, no matter who you are, even for HHS, you have a budget of nearly $1 trillion a year, with tons and tons and tons of people who are very smart working for it, right? You recognize that most of the smart people in the world don't work for you, right? And if you really want to make something happen that's transformative for society, right, get those smart people to care about what you care about, and empower them and enable them to do the right thing. And I think that actually the CHDI is an example of how to do that, right? By basically saying, well, you know, the government, we can supply a ton of data for free in a way that's easy to use, but that America and the world globally can harness its collective ingenuity and turn that data into just a dizzying array of uses and applications and services and products and insights that can help improve the health of the nation. So that's the gist of how we're trying to roll. We're trying to create an ecosystem of innovation that does that. It's kind of amazing that this only got started 2 months ago. And it's proceeding at light speed, which is kind of exciting. Again, not because, you know, I'm pushing it at light speed. You know, it's because there's a ton of brilliant people who've come into it and got excited about it and are doing really amazing things to put data out there and turn it into useful stuff for America. So that's the gist of it. I don't know if I sort of talked overly rapidly. I'm so stressed out because we don't have time. Does that make kind of general sense, or was I totally in your head? Okay.
Very sexy.
So Bill Core I have to meet with at 5:30. How long do you think it takes me to get back to HHS?
15 minutes.
Okay, 20 minutes. Okay, so I've got a full 20 minutes to chat. So one issue actually that came up I wanted to kind of engage on is there was a discussion earlier today about suppression of data. I thought this was actually very interesting because the people at HHS are like super paranoid about putting data out there. If they don't think they've got a cell size that's large enough, right, and they think it's actually not significant statistically, they'll like suppress it, right? But I heard actually earlier today that there are some folks, at least here, who say, come on, we're grown-ups, okay, we understand the data is a small cell size, right, but give it to us anyway because it's better than nothing, so at least we can maybe figure out how to parse it up and mash it up with other data to try to get something that's significant. Is that something that is a minority opinion, majority opinion? Would you rather not have the data, rather have the data? Give us the data! Okay, data liberator right there, absolutely. I mean, is there an argument against doing that?
I'm Maya Talaludin from the online community. I work for Buffalo and Cutting. Looking at the HHS study, I'm very curious to find out, one,
Yeah.
how you folks are handling Indian Health Service data, because the tribal sovereignty rights and access to tribal identified data,
Yeah.
and the sovereign right of the tribe to not have their data released publicly.
Yeah.
And how does that, as we as Native Hawaiians are entering and having conversations about access to Native Hawaiian data as a
Yeah.
sovereign entity,
Yeah.
or as a tribal group, or however it may be or we move into, how will we handle the rights of our data that may be collected at a federal level if it's still aggregated in with a larger either API, NHOPI, or in any circumstance in which we have a difference issue around sovereignty and control of information, and how can we still engage in the process given issues around sovereignty versus free access and open data for everyone?
Okay. That's a great question, and just forgive me if I ask incredibly basic questions. I've only been doing this for a year. So right now, is HHS releasing any of that data?
Well, like the tribes, Indian Health Service can't even release data
Yeah.
to anyone who is outside the federal data system.
Even at an aggregated level?
Because if it's tribal identified, it is the right of the tribe, because
Oh,
they are
wow.
a sovereign entity,
Yeah.
government to government, to protect their tribal identity. And that's the kind of granularity for Native Hawaiians we serve, if recognized, will be the largest tribe in the United States.
So, and are Native Hawaiians actually covered in that same data?
Not at the moment.
So the Native Hawaiian data is in fact released?
Correct, if it's released at all. Right now, it's not really being released.
It's not being released, but not because of the same reason that the Cherokee data is being released.
Correct, it's being not released because the cell sizes are too small.
Cell sizes are too
To
small.
release Native Hawaiian Pacific Islander data even separate from the Asian American category.
Okay. So one issue is basically small cell size. Another issue is that
I guess
sovereign.
my first question is really
Yeah,
about
sovereign nation.
confidentiality, and because,
Yeah.
working with DHHS data,
Yeah.
how do you folks deal with the issues around the confidentiality, not necessarily of an individual, but
Yeah.
of a community and a community's right to not be stigmatized.
Right.
Or held, like, to have research being done on their data that may say, oh, Hawaiians are all schizophrenic and therefore should be denied access to health insurance because of major risk factors due to a racial tone or something. I mean, like, how
Well,
do we
so-
protect group harm in
Gotcha.
releasing of public data?
Can I ask one more question, actually? And then I have a hypothesis for the group to test. So when say, NCHS, does, or when CDC does surveys, right, in geographic areas, which include actually, say, sovereign tribes,
Correct.
are the microdata, the person level survey responses, actually included, that ones for the tribal areas included in the
No,
overall
tribes aren't included in most
surveys?
Indians, 67% of the Indian population is no longer on reservation. It's 2.8 million people.
Okay.
That are in the general public. If they are called and contacted through a random sample,
Then they're included.
they're included as a general population. But tribal sovereign entities in which
Are not covered by the
are
state.
not covered. Hawaiians are not a land-based people, though.
Got it. Well, so here's my kind of overarching question then, because I had an interesting conversation with an advocate for the tribal community recently, who actually was worried that the data that we were releasing would actually demonstrate that health isn't as good in particular tribal areas. And so one thing I wanted to follow up on was actually this question of what exactly is the sampling that we did, But it was kind of, I had kind of a completely different underlying assumption, which was that if there's a disparity, that's important to actually show, right? And we don't want to hide that, because people will actually want to see which parts of the country potentially need more help.
Unless that community is then stigmatized and harm is caused to them due to that identification having a specific defect or disparity that may not simply be diabetes, but let's say it's alcoholism.
Okay.
Or something, schizophrenia, or something that may
I
create
see.
harm against the population.
I see.
And this is the case of the Havasupai tribe and the research around genetic testing for schizophrenia.
Yeah.
And other things that have come about around protection and the way that data is used that can harm people. With open source data, liberating data is important. Our talk was just on liberating data.
Yes.
But at the same time too, we have to understand that there is the potential of harm if data is misused. And what are the kind of conversations that could be held so that we can have open data while still ensuring that communities are not harmed by the use of that data?
Yeah, okay. That's a great question. I mean, I would say, that, at least from what you just told me, and I'll do additional research, it sounds like actually HHS is, with respect to the tribal issue, kind of erring on the side of keeping it all inside, which may be the right answer. But I think we should just have actually have a open conversation about that, and then talk about the pros and cons. Because I think that disparities are a really important issue, and the Secretary is personally championing attacking disparities and trying to close them. It's hard to close a disparity if you don't know they exist. I mean, a lot of what these journalists want to do is actually highlight disparities. I mean, like, for example, I remember one actually signature moment in March 11th was, I think Ed Sonic was like casually reeling off the fact that infant mortality among African American babies is like double that of white babies. And like all the Silicon Valley was black. And it's, well, of course you know that infant mortality is much higher among kids. No, I didn't know that. That's a scandal. That's crazy. Why is America furious about that? And it's like I won you, and it's still guys we didn't know. And we're data geeks, right? I mean, we're the kind of people who probably you would expect to know because but they didn't know, right? And so, but their response wasn't sort of stigmatize African Americans. It was, oh my God, that is a national scandal. We have to do something about it. And so I think we've got to weigh that against the possibilities of stigmatization. And so I think that's a phenomenal conversation here, which actually leads to another question I had, which is around governance, right? So, as people who have sort of been swimming in data and live and breathe data, right, and live and breathe these data for public good, right? How would you think about governance of something like this? Right, because its very power is that it's actually decentralized, right? But at the same time, it's probably not a community that shouldn't have any kind of governance at all, right? So are there kind of pieces of advice, suggestions, best practice guidelines, or thoughts or models you have about how you would actually bring some kind of governance that helps the community blossom in the right ways without overly centralizing management of such a community?
Were you asking a question?
Yes.
Oh, I'm sorry, I had a question, go ahead.
Oh, okay. And I don't have to get the answer now. But you know, I mean, yes.
Well, I'm sorry to be the one to keep talking.
That's
but
great.
doesn't CDC already have a process in which anything that is written using CDC data has to receive clearance through the CDC
Yes.
process? So
Yes.
what would be the process for someone who used data off of the system to receive clearance for a publication using that data? That seems like now we've circumvented the entire CDC process by accessing the data, and now we don't have to even go through CDC. We can just publicly release it and not go through the 3-year process of having CDC or proof or look over or vet our analysis or reporting.
So there's a governance process for what CDC will actually collect, right? In terms of the data that we're actually publishing, right? You know, which is not person level data, except the blue button in there. We're not releasing it to anyone other than you, right? You can get your own data, but no one else can, right? So in general, the data that's being liberated is aggregate data, or data that doesn't relate to persons at all, like pub cat. So, I mean, the conditions in which we're making it available are, it's free, and it's made available without intellectual property transparency, without data restriction. And so anyone can do whatever they want with it. We think that's actually important to make sure that we don't kind of stifle innovation or make use of it. You know, but one interesting point that's been raised is that the people that actually are using this data, downloading this data, have a huge appetite to learn more about it and learn how to properly use it, right? And so there's this phrase that we call health meteorology, right? It's a discipline that's actually, I think, going to be in growing demand. I wonder if there's a mechanism via which you know, the people who know the health data incredibly well, right, can be connected with people that actually are working with the data in a community. Maybe it's the online community, actually to learn more about the data, be taught more about the data, teach about the data, so it's used effectively.
Maybe you guys already have some system like this and it's connected to the sort of approval. Could you have starting with varying levels of like a blue ribbon way to use our data and like a medium level way and a really bad example way? So folks could like strive to be at the blue ribbon level or some way where folks are actually meeting a threshold that folks would go, oh, this is really valuable. Really big as new person.
Well, one of the things actually we're doing is this virtual expo, where it's a kind of inventory of uses of the data. It's not necessarily comprehensive, but it's going to be part of the healthdata.gov community. And one of the things we've actually been debating is whether or not to turn rating on or off. Those examples, right? Whether we should let the community actually rate. I mean, actually, what you just said, maybe we agree maybe we should try rating, so that the community can actually vote on what they think the coolest uses are, or vote down the ones they think are like not totally cool at all, or something in between. That might be actually interesting.
I think for our communities, there's sort of two prongs. There's letting people use the data, but also the federal government is a place where really good models of way data should be used and qualified. So that you have both open data anyone can use, but also examples of really good data the federal government is using. This is an example, because I received the ACS data form, and I don't think I represent actually a lot of, I'm a single young professional young person in DC. I know the rest of the young people, but I'm going to represent 200 young people across the country. So I was like, this is not really the best way, I think, to look at the data. I mean, so I sort of already know who this group is going to be. So back to the earlier question, I think the data should be available, but if there's ways to qualify it or give some ways to show the basics of making sure that it's used well.
You know, actually, here's a cool idea we should consider, right? I wonder if on healthdata.gov, right, when you list a data set, if people could actually, because right now we allow you to rate the data sets or comment on data sets. I wonder if we actually put in a place where people can actually offer tips and guidance for how to use this data. Like sort of talk about how to use the data, how you should not use the data, et cetera. But kind of crowdsource from the community tips on how to use this data, how not to use this data. So I think that, because one of the things, you know, that HHS is going to confront, because it sounds kind of strange for $1 trillion agency, but you know, we're entering pretty tight fiscal times. So one of the issues that people have is, well, how are we going to really properly educate everyone about this data? And I think the answer actually may in fact be not have HHS do it, right, but have the community help with it. NOAA actually has an online Yahoo group that talks about weather data, where people educate and discuss around weather data. It's actually not run by NOAA. Like NOAA has like 2 developers that occasionally pop in to contribute, but it's actually run by the community. which basically discusses metadata, talks about defects, talks about actually communicable about, ask questions about, so forth. So maybe one idea is to actually enlist the aid of the community, the people who care about a particular data set, right, to offer tips online about the data.
Yeah, we can beta test it with a couple of data sets,
Yeah.
big data sets, and see what happens.
Yeah.
So you should probably.
I should probably go? Okay. Oh my God, okay, I should probably go. Well, thank you so much for having me on. And we'd love to follow up with, on the challenge, I think. that
Yes,
we were about to talk
so
about.
before everyone goes, please don't lose just this minute, 2 minutes of your time. We wanted to make an announcement, and Audrey is passing around, thank you, Todd. Oh, bye. Okay. And I'm gonna make sure that I'm doing this right, so if you can just hang around for 2-3 minutes. We're passing around some index cards that we ask you to hold on, and we'd like to have you turn them in tomorrow. But first, I'm not gonna actually pose this challenge to you. I'm actually gonna just give you a little bit of background information, which is, one, we are planning this exciting economic summit in Silicon Valley, January 7th, with Asian American, Native Hawaiian, Pacific Islander entrepreneurs. Obviously, Silicon Valley is as known as the hub of, and some of the events that have taken place already in Silicon Valley, where there's just a lot of great energy and innovation to tap into. So as a part of our effort within the initiative, and this really came about focusing on all the concerns around economic recovery and making sure to get information out to our community about all the efforts that the administration is doing to support small businesses, to support entrepreneurs, whether it's the National Export Initiative that Secretary Locke, our co-chair, is pushing, to trade issues, to tax credits for small businesses. You name it, we're going to be talking about it at this economic summit about 500 of these entrepreneurs, and then we hope to be taking something similar on the road to other cities. So that's the background for you of all these people that we're going to be hanging out with in Silicon Valley. And so we thought, oftentimes, like Todd was mentioning, we are kind of operating these segregated groups, right? Like the health people, the folks who work on, the business leaders. It's like, well, I know, Brad, you're making a good effort to like connect in a lot of different areas, right? So, but I think for most of us, we operate in our silos. So we thought, what would be a great idea to bring researchers together with these entrepreneurs? So that leads me to introduce Audrey with our challenge, and based on what Todd has already talked about. Audrey?
I think you could probably hear me. I'm a loud talker. So here's really the deal. We just went on the sexy data train. That's really why we wanted to post this challenge to you. But when we heard Todd Park, we got all excited about this My Healthy People challenge, and we immediately thought, how can we plug into something like that? And to be honest, I went home and stayed up until like 2:30 in the morning researching these challenges and challenges.gov, and I came across this really cool application kind of on the side that these New Zealand developers made for smartphones. And it's called Bully Stop. And basically it just allows a parent to control, kind of snoop on their kid basically. But it's under the guise of controlling for bullying, right? So they can look at the kids' text logs, their call logs to see who their kid's been talking to, and then they can see if their kid's being bullied, they can see if their kid is the bully, they can block bullies from calling their kid. And I thought, how cool would that be if we could have some kind of app that stems off of that? We don't know how many bullies there are or how many bullying incidents there are that go on in our community. We hear a lot about it. We hear anecdotal evidence. But what if, kids could actually have this app on their smartphone and they can actually report it? It could be like, I'm being bullied today. This is just a crazy idea we're thinking about, and we thought about it based on the asthma inhalers. So then we thought together, let's do a challenge. Let's put something on challenge.gov. But obviously we're not the experts on the cool things we can do with data. And I'm only thinking in this small lens of bullying because we've been talking a lot about that in our office. But we want to post. So it's a twofold challenge. The first challenge is to you. We want you to come up with something that you'd like to see. Think grandly, think wildly, think in every different area. And you only have till the end of the conference tomorrow to do it. So get on the phone tonight, call your friends and think about it. We're not asking for parameters and guidelines yet. We just want a really cool idea, something feasible, but something really innovative. And then we're going to review it over the next few weeks. And then because we have this January 7th Economic Summit,
in Silicon Valley, what better way to, I think, what did Todd say? We want to get the right people together with the rock stars of data and make it all magic or something like that. So we thought, yeah, sexy, magic. So we thought, okay, so this will be our opportunity. We're going to make our decision, and then at the January 7th summit, we're going to announce whichever researcher or attendee or their team of people that came up with this great idea, and then we're going to consult with you and come up with the guidelines and the parameters. And so January 7th, we'll post the second of the challenges to the Silicon Valley people and say, now we want you to develop this application. So we want it to be some sort of application related to data. That's it. Just think broadly. Think the world is your oyster, right? What are you going to do? But, not too cost heavy.
Anna, do you want to add anything about how?
Yeah, no, that was a great description. There's been a lot of these, challenges that have happened. Some people call them app challenges, and so the variation is huge. You can think about, somebody visualizing, all the stimulus money that's been spent, and then you have this insight to things like, there's I think it might have been the DC government a few years ago, where people are having trouble getting, services in their community, and somebody created, I think, see, click, flip, fix, which means you could say, okay, there's a car that's stuck in the snowdrift here. This is where I am. I need some help, and it allows you to send a text message, and anybody's in the community come and help you. To other types of problems that people have solved this way, and so I really think like what you said is think broadly. What's a challenge you'd like to have somebody solve? If you could wave a wand and put it on your card, and obviously they'll consider this wide variation. So I think very broadly in terms of that. I'm trying to think of some of the other challenges that we've had, but they've been extremely broad. And so it looks like you have a.
Yeah, I was wondering, since this conference is about data and research and this is about the Asian and
Yeah.
one specific government community, can we add parameters that it be somewhat related to that?
No, it should be around.
Yeah, just make it clear. Not
Sorry,
too
that's
broad.
that's
It'd be
right.
great if the one that gets picked
Yeah.
actually promotes
No,
and supports the
That's a
idea.
given, I mean, our initiative,
Just
our
wanna make sure,
mission,
yeah.
what we're doing here, it would be good to have it specific to the kind of data we're interested in, right? Which is around Asian American Native Hawaiian Pacific Islands.
Yeah, I'll just give another example. This wasn't out of a challenge, but you can imagine this coming out of a challenge. There's a professor of computer science at UCLA, Deborah Estrin, and she's been working with a community in Boyle Heights. And she told a story where previously, years ago, nobody really had a good handle. People in the community have a good handle on documenting dilapidated housing. And somebody came up with a mobile app to be able to document, where's there dilapidated housing, where's there graffiti, where are things broken down, and take photos. And she, just basically, she's built on top of that to allow people to take photos. That information is now all crowdsourced. Somebody actually took that data to the local housing board, and because they saw data instead of just anecdotes, they actually were able to do something. So driving that so thinking about driving change also. And so that's what I mean by thinking broadly.
Do you have anything like written or anything
Okay,
like that?
so if you go to challenge.gov,
Okay.
you'll see a bunch of different challenges that agencies have put out there to see how this moves. And I think it is about that, the government is just not gonna have all the ideas, frankly, probably, have too many of them, but, it's really working together, to pose the agency has this, and the way the challenge.gov works, and they're really quite broad, is that they're dealing with an issue and they can't figure it out themselves, or they really like your help, and so they're posing this challenge. And so for us, it's like, here we are bringing two entities together, and with the developers who we hope, because they're from our community, would be particularly interested in what we care about as well. I mean, it could be a big assumption, but we're hoping that, it's something that we can get them excited about. And like Todd was mentioning, I mean, they gave folks 90 days to put something together. And it doesn't have to be necessarily an app, maybe it could be something else of a challenge. So we'd like to pick up, we'll be coming back together tomorrow. So if you have, I guess, less than 24 hours to maybe come up with whatever ideas, obviously you can email us later on, but we thought what a good way to bring these two groups together and be able to move this idea forward that I think actually is pretty exciting.
I think ideally we do want to be an app though, because that way we're going to challenge the Silicon Valley folks to build that. It'll be a good, jumping off point for them. Because I mean, if you look at challenge.gov, there's a wide range of challenges that are not necessarily technologically based. For example, Department of Ed did something about come up with really innovative systems for education and involving parents and families in the education system. Not at all related to technology. But I think if we can relate it to technology, it's going to be a huge sell at the Silicon Valley convening.
I know it's been a long day. I know you guys are ready to get out of here. So we will